It's another day with the physicians where your health is our business.
The growth spot will end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what
You're welcome back to the different also your regular program.
So if we look at the eyeball, it's shaped like a ball, like football.
Yeah.
So the front 1/3 of it, this part is like the glass of the eye.
Colon cancer is a type of cancer that begins in the large intestine. This cancer typically affects older adults, though it can happen at any age. It usually begins as small, non-cancerous, what we call benign clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancers. Polyps may be small and produce few, if any, symptoms. For this reason, it is recommended to have regular screening tests to help prevent colon cancer by identifying and removing polyps before they turn into cancer. We will be speaking to an expert on your regular Health TV talk show, The Physicians. Welcome back. If you're just joining us, this is The Physicians, where your health is our business. We will be talking about colon cancer today, all about the causes, the risk factors, presentation, and of course, management. My name is Dr. Memuna Yusuf Kadri, and of course, with my regular co-host,
I'm Dr. Martina Agberia. Welcome to The Physicians, where your health is our business. It's always a pleasure knowing that you are always seated, waiting to watch our program.
So we're talking about colon cancer, and I'm a bit worried because in this climb where we are, we don't really have preventive health culture. And from what we are seeing and what I read earlier, is more in the elderly, but it can happen at any age. Any experience sharing of anyone?
Yeah, the truth is that colon cancer, in fact, all cancers are preventable if detected early. Exactly. The challenge we have is actually people not availing themselves for
that early
screening and detection. Okay, so because most times they only present when it has gotten out of hand.
But my major worry in Africa, in Nigeria, is that poor preventive health culture, where you know that on a yearly basis, as far as maybe from 30 years of age, maybe let's leave the 20s, because you say you are too young to be doing screening, right?
Sure.
Maybe from 30 years of age or from 40, regular health, every year you do your screening, just to be sure that there's something, you know.
I think the onus is on us for us to always remind people to do their health checks, okay? Like one doctor said on our program, he said, you can actually give a friend your birthday gift.
You're right. It's not about this chocolate and sweets
on your birthday. Let it be that is the day you want to go and do your
like a
health
voucher.
check.
I can say, look, I'm giving you this voucher of 200,000. Go for this
health check.
Well, we have an expert coming on board, and I'm sure he's a walking encyclopedia when it comes to cancers and other colon cancer and others. So we'll be right back after this timeout. you're just joining us, this is The Physicians, where your health is our business. On today's episode, we will be discussing colon cancers, the causes, risk factors, presentations, and of course, the management. With us in the studio today is no other person than the amiable Dr. Anderoa, Temitope Anderoa, who is a clinical and radiology oncologist with NSIA, Lagos University Teaching Hospital Cancer Center. Dr. Anderoa, you are welcome.
Thank you for having me here.
Nice having you on our program.
Thank you very much.
Welcome.
We are discussing colon cancer today. But of course, for our viewers, they're like, yeah, you said it's part of the big intestine cancer. Let them just know, what is colon cancer?
Thank you very much, Dr. Kadri, for the question. What we do know in this part of the world, the knowledge about cancer is still not so much. Not until somebody dies of cancer, and then we begin to hear that, this person died of this cancer or that cancer. It is at that moment that some people, get to know that, indeed there is something called cancer, or possibly maybe somebody, a very big person. So the awareness is actually poor. We are talking about colon cancer. To begin with, like you asked, what is colon cancer? Two words joined together, the colon,
absolutely,
and of course, cancer. Now let's talk about cancer itself. I will explain this way: that naturally, the body cells are programmed in such a way that they have the ability to grow and then divide, and then up to a point, then they stop growing. It has been so programmed. However, in cancer cases, they lost this ability. There is this uncontrollable, growth and cell division, even when they are supposed to stop, which are due to certain factors. We are going to talk about the course of our discussion. So, simply put, cancer is a disease entity in which the affected cells, they lose their ability to stop growing, and they continue to grow uncontrollably. But why is cancer so much a concern and a world burden? Something is so peculiar and unique to them, unlike other disease conditions. One is the ability to encroach into the surrounding tissues, thereby affects their functions, and then the tendency to spread to other distant organs, which we use the word metastasis, and that is where the problem comes in, and ultimately it could lead to death. And that is why cancer is so much a global, a world health burden. Now, colon, we have the food tract, otherwise known as gastrointestinal tract. It begins all the way from the mouth and then ends at the anus. We talk about the mouth, the esophagus, the stomach, the small intestine, and of course the large intestine, which is the subject of our discussion today. I will also be quick to add, interchangeably sometimes we also use the word colorectal cancer. And that is when we are talking about, the involvement of the colon, the large intestine, and then the rectum. However, the disease could, spring up from either of these two, and of course, their mode of management could even be different.
Okay, different.
Yes. Of course, generally the same. However, there are some points where we'll have to, treat uniquely, just because of the unique anatomy they have.
The colon, maybe for the purpose of people that are out there, some people know where the colon is. Some don't know where the colon is.
Yes.
So tell us where the colon is. And also talking about the cancer, as you said, it has to do with replication, multiplication of cells, the growth which has stopped, which refused did not stop, continued.
Exactly.
So what are the causes of colon cancer? Okay.
Thank you very much.
What are the risk factors, if I may put it that way?
Yeah, another good question. Like I did say earlier, colon is simply the last part of the gastrointestinal tract, which is the food tract, simply put, from the mouth to the anus. And then when you have cancer in this region, we call it colon cancer, or at the rectum, which is just a little bit after the colon, we call it rectal cancer. Talking about the risk, I'm talking about the causes. Generally, we say the causes of cancers are not known. However, exactly.
However, I like that. And most times when you say causes are unknown, then the doctor will not say however.
Exactly. And that is just the way it is. However, there are risk factors. What do we mean by risk factors? We are saying that when certain factors are seen in a certain individual, the risk of developing such a cancer is higher compared to an average population. And then for colon cancer, the risk factors generally age is the most common, I would say.
So the older?
Yes, the older you are,
the more at risk.
Yes, of having, especially the moment you clock is 50 and above. However, of course, people with mature, I have so many patients in their 30s and 40s with colon cancer. But we are saying people from age 50 and above are at a much higher risk of having colon cancer. So the older you are, the higher the risk, simply put. We also have some disease entities which could make individuals, to be prone to having colon cancer. One of them is what we call ulcerative colitis and Crohn's disease. They're kind of chronic inflammatory bowel disease that they run a particular course over the years, and over time could be connected to colon cancer. Other risks include polyps. We're going to talk more about polyps and as it affects colon cancer. We also have individuals who must have been diagnosed of colon cancer before, well treated, and maybe apparently cured. They are still at a risk of having
relapse.
Yes, or rather even another cancer entirely along the same food tract. Another one that we know are certain inherited genes or conditions. The common ones are the one we call familial adenomatous polyposis. Not to use a lot of technical word, there are things we inherit.
So there's a familiar history.
So there's a familiar
kind
history.
of similar to that. So almost in 100% of cases, people with that gene are at a risk of having colon cancer. There's another one too we call hereditary. We have Lynch syndrome, we call it anyway. So.
And that can run in families too.
Yes, hereditary non-polyposis and colon cancer.
So what about people with obesity, people that drink and smoke?
Of course. Yeah, I'm going to talk about those ones too. And then family history, a blood relative having colon cancer makes, if my father had it or my mother died of it, for instance, I'm at a higher risk compared to an average person without such it. We are not saying it's not an absolute statement. Because my father died of it or my mother died of it, that doesn't mean I'm going to have.
No, because that information is very key because it helps the individual to go for
exactly.
On time.
Exactly. And like she did mention, of course, we do know that diet too plays a very significant role. Food laden with fats and low fiber. That's low fiber diet. And then, fat-laden diet, could, especially westernized food, could make people to be at risk of...
so fries and all that?
Exactly, including all those, but generally, food rich in high fiber and, low fat could, make you to be at a lesser risk of having colon cancer.
I want to hit the street with keeping up with the physicians, and let's hear from you what you know about colon cancer. We'll be right back after this short break.
one of our Nigerian famous musicians, I heard that he died of colon cancer. But I know there's a colon cancer, but I don't know what the meaning.
I think that it's something that comes inside the large intestine of human body, which needs to be treated on time.
Colon cancer is by changes or mutations in your DNA, mostly in the large intestine. That is where it begins from. So when you begin to observe certain changes in your large intestine.
But I think that the cause of the colon cancer should be something that is already inside the woman's body for long, and the person has not taken care of that or seen a doctor or anybody to just cure that before it actually come out like that.
The possible causes of this colon cancer could be obesity for those who are obese, for those who smoke. They should be watchful. For those who take lots of alcohol also, they should be mindful of that. Those are the things. Then you should also look at yourself very well. Certain things or meal or food you take into the system is not everything that is eatable, not everything is drinkable. So you have to be watchful. Some of these things could lead to colon cancer.
Because I would say, can I say, living a stagnant life, eating any type of food, diet, without consulting physicians, and
the prevention aspect of it has to do when you know the causes, what leads to it, then you should be able to know how to prevent it. Stop smoking, stop taking alcohol when you observe certain things. Take for instance, when you observe that when you stool, you discover reddish like blood, let me use that word, in your stooling, then you should be observant about that. Then you have to be mindful of yourself.
Be prevented by living well. You have to live well, maintain your healthy something, stay at ready, consult your physicians in certain occasions how you feel, and he will tell you how you live. And once you follow your physician's advice, definitely things will be well with you.
It can be prevented if the individual seek medical advice time to time and actually watch what he or she takes inside of the body.
The hope and prayer to God, and always visit a medical man, seek advice from him or her, and he or she will tell you what to do.
What I actually advise fellow Nigerians to just take precaution, go for regular checkup, and do what's necessary for the body, so as prevented of having cancer. Thank you.
Well, my final advice to people is, you know yourself much better than any other person knows you. When you observe certain changes in your system, your body system, rush to see your physician.
Welcome back. If you're just joining us, we've been having an amazing time being schooled on colon cancer. In fact, cancer in general, but narrowing down to colon cancer. Now back to you, Dr. Anderoa. Signs and symptoms, or maybe before you even go into signs and symptoms, you held on a particular question. You want to deep dive on polyps.
He talked about obesity.
Polyps, no, he said polyps and how it links to cancer.
Oh,
yeah.
Yes, of course there is a connection with that, and I can also even connect that to the clinical features.
Exactly.
I mean
the signs and symptoms.
Yeah, so I can connect that. And that will be my starting point when talking about the signs and symptoms. To begin with, at the very early stage, it is asymptomatic. In other words, people go all around with polyps, so to say, which apparently do not even show any kind of symptoms. So polyps, so to say, are just like clumps of swelling lining the intestinal wall, specifically the colon, right, which over time could kind of progress to develop to an overt cancer for those who are predisposed to having cancer, especially for those who are at risk. Let me put it that way. In other words, it's not everybody that has polyps that will ultimately come down with cancer. We have people who are at a higher risk, just like I mentioned earlier. Now, talking about the symptoms, you know, in its earlier stage, it is asymptomatic, you know. However, as it progresses, as it advances, the symptoms will also depend on, one, the size and also the location. But generally put, things we do know that people present with, the complaints, it ranges from irregular bowel habits, which could come in form of intermittent diarrhea and constipation. You know, I'm having diarrhea today, tomorrow I'm constipated, which I cannot really attribute to anything, other diets, you know, and then I've used all kind of medications, and then it just doesn't stop. It could also come in form of bleeding through the rectum, bleeding per rectum, which could be an overt frank bleeding, stool mixed with blood, you know, or occult bleeding. So the occult bleeding is, we're talking about something that is just leaking from somewhere. It's not apparent. You flush your poop and you couldn't even notice it, but then something is leaking gradually from you, just because there is a cancer that is already, you know, that has come to stay inside such an individual. And then abdominal discomfort and pain, and something we call tenesmus. What is tenesmus? There is this feeling of, oh, I feel like I just came back from the restroom, but there is this feeling that I didn't empty my bowel. You want to go back again, and then you are there seated for a couple of minutes, and then you are like, this thing is not coming. Let me go back to my office or wherever you are working. And then you still have this sensation of, I think I still need to empty my bowel. We call it tenesmus. It could be, you know, a signal that something might just not be right. You know, I mean, pain generally, you know, gas, and then fatigue and weakness. And this we can trace to either somebody losing frank blood or occult blood. And this could be due to anemia. And for some people, that is even how they get to know that something is wrong, because they are eating, you know, I mean, apparently everything seems to be going well, but then they're just weak. They just can't explain it. And it is just because they are losing blood, and maybe accidentally going to the clinic for maybe their routines, maybe malaria, whatever they have. Oh, Mrs. So-and-so, Mrs. So-and-so, you are pale. You are having anemia. Maybe they run a routine test, you know. So all those could be, I mean, one of the signs, I mean, the symptoms that
the patient can present with.
Yes, the patient can
Thank
present
you.
with.
You have listed a whole lot of
And of course, weight loss. I was going to talk about weight loss too. Unexplained
weight loss. You have talked about unexplained weight loss, constipation with diarrhea, and bleeding, and with frank blood, and so on. I'm sure the viewers out there, they have heard. We have listed all these things there. How are we to manage it? How can it be managed?
Yes, thank you, Dr. Martina. Another good question. To talk about the management, I probably might want to start with prevention, or maybe we can talk about it later.
No, we can talk about prevention, then management.
Then the management. So the reason why I was trying to flip back to starting from that is, you know, these conditions are even better prevented. You know, and then or more so detecting it very early, because that's even the key.
Early detection.
Exactly. So we're talking about, for someone who must have kind of had certain symptoms, that they've used all the regular medications, they've seen their they've been to their private hospitals, been given medications, and it appears they are not they are not responding to those treatments, and then, you know, could be a red flag that something is just not right. So, and that should be the starting point, going to see your doctor, you know, for further screening, evaluation, and more investigations. I'm going to connect that to management, Dr. Martina. Now, number one, it has to be diagnosed first. Yeah. At least the doctor will need to know, okay, this is what you are having, and then be able to say, okay, how do we design your management protocol? What do we do next? You know, yeah, and of course, to manage, the doctor will start from running certain screening or running certain investigations. People range from ordinary regular ultrasound scan to CT scan, MRI, to, you know, trying to assay for special chemicals called tumor markers. Of course, those ones are not diagnostic, but they could give us a red flag that something is just not right. Then ultimately, to make the diagnosis, such a patient will have to, individuals will have to be, you know, arranged for a special procedure or sent for colonoscopy to view, look into the rectum all the way to the colon to be able to locate, oh, okay, so based on these symptoms, the areas of symptoms and the signs picked by the doctor, like, okay, I think something is wrong in here, so please, let's take a look at it. And then two things are achieved at the same time when doing colonoscopy. Looking through the colon, trying to locate the exact the site of the tumor, and then taking a little bit of it to the lab. And that is where the, you know, diagnosis is made. For us, if you walk into our clinic, oh, doctor, because it's not every complaint of abdominal discomfort or all the symptoms I mentioned earlier. In fact, most of the time, they are not even cancerous. They are benign conditions. They are regular conditions. Someone who have, you know, what they call hemorrhoid, bleeding parectum. So it's not every case of bleeding parectum, abdominal pain that are cancerous. So it is when you walk in with this diagnosis written, adenocarcinoma of the colon, of the rectum. Okay, it is established now. Okay, now let's talk about the management. That is the time we now sit down to talk about how to manage. And how do we manage? How do we manage? So, like I was saying, management of colorectal cancer involves different treatment modalities. In fact, it is a multi-disciplinary approach. It does not begin and end with, I'm a radiation and clinical oncologist. It does not begin and end with me. You know, it is a teamwork with general surgeon or, you know, oncology, you know, I mean surgeons who are into oncology, you know, cases as well. So, and then there's a place for the patient having surgery, you know, which could come first, or there are times when the oncologist will have to come in to give chemotherapy. Yeah. So, but generally speaking, the treatment modalities is all around surgery, medical, which could be chemotherapy, targeted therapy, immunotherapy, and of course radiation therapy. But radiation therapy in this part of the world, it is more for the rectal carcinoma than colon cancer because rectal is more fixed. Colon, you know, moves around there. Not so stable.
Thank you very much. So my name remains Dr. Memuna Yusuf Kadri. Until next time, stay blessed.
Well, we've heard it all. Thank you so much, Doctor.
Thank you very much.
Nice having you and schooling us again on colon cancer. Same time next week. Ensure you keep a date with the physicians. But remember to always follow us on our social media handles, on Facebook, on Instagram, on Twitter. And if you want to be part of this program, just a click away, just send us an email, and you'll be right here with us. My name is Dr. Martina Agbere. Stay blessed.
Hello, my name is Dr. NSIA. I'm an endocrinologist and the medical director for Rainbow Specialist Medical Center, Lekki. You're watching The Physicians. Make sure you stay tuned, follow them on YouTube and all the social media handles.
I always do this because autism is such a broad issue. And I take the pains to always say that when I'm talking about autism, I'm talking about my own personal experience with autism, because in the autism community, we say that when you see one child with autism, you've seen one child with autism. So every